You're watching LTC News with Dane Henning.
Welcome to CNA TV Long-Term Care News. I'm Dane Henning, and today is Friday, March 2nd, 2018. In the February American Journal of Infection Control, researchers concluded that implementing simple hand hygiene protocols in nursing homes helped drop both mortality rates and the number of antibiotics prescribed. According to the Association for Professionals in Infection Control and Epidemiology, U.S. nursing homes tally upward of about 3 million infections, leading to the #1 cause of death in nursing homes. Infections in nursing homes also account for around $1 billion in extra healthcare costs. 26 nursing homes were used in the year-long study where all parties had greater access to hand sanitizer, a campaign to promote hand hygiene, and localized work groups for education and guideline review. The intervention saw a 21% decrease in mortality rate and a 14% reduction in antibiotic prescriptions. To view the full study, go to ajicjournal.org. McKnight's Long-Term Care News reporting. A video of a veteran's farewell goes viral. Richard M. Campbell Veterans Nursing Home in Anderson, South Carolina paid tribute to Air Force veteran Douglas Timmons after he died last Wednesday following a long battle with Alzheimer's. He was 81.
Timmons, United States Air Force.
The video was posted to Facebook and been viewed more than 7.3 million times and shared more than 159,000 times, Fox News reporting. McKnight's Long-Term Care News reports a bipartisan governors group wanting to improve care and reduce costs using value-based payments and Medicaid innovations. Governors John Hickenlooper, Democrat from Colorado, John Kasich, Republican from Ohio, Bill Walker, the Independent from Alaska, Tom Wolf, Democrat from Pennsylvania, and Brian Sandoval, the Republican from Nevada, issued their solutions in a 7-page blueprint issued late last week. Proposed approaches include expanding affordable health care coverage through private insurance, Medicare and Medicaid, targeted government action when marked forces don't achieve objectives alone, providing state flexibility and improving the regulatory environment. Kasich told reporters February 23rd that implementing the blueprint could save the federal government $1 trillion in the safety net program alone. The Supreme Court Monday took on a case that could weaken public unions' collections efforts and ultimately limit their power. Justices heard arguments on behalf of Mark Janis, an Illinois child support specialist who is suing the American Federation of State, County, and Municipal Employees. Illinois is among 24 states that allow unions to charge agency fees even when workers don't want a union membership. Janis's attorney said that those fees violate free speech rights because he often disagrees with union action. The unions say that court's decision would affect more than 5 million public sector workers in those states, including the District of Columbia. Across the country, workers represented by unions that depend on fair share fees are apprehensive about how the case will shake out. Those working in nursing homes are often unionized, including some 5,000 at the 53 Chicago area facilities alone. Last week, nursing staff protested outside of San Mateo Medical Center in California, as well as 6 other hospitals across the state to advocate for the preservation of the current union rule. A ruling is expected by late June, McKnight's Long-Term Care News reporting. A Kentucky couple delivered a little love to a local nursing home for dementia and Alzheimer's patients on Valentine's Day with baby dolls. Sandy Cambrone lost her mother-in-law Pearl in 2008 to Alzheimer's. It was a little baby doll that helped the elderly woman through her final days. Pearl was even buried with the doll. In the years since, Cambrone and her husband Wayne has been delivering toy dolls to dementia and Alzheimer's patients in nursing homes throughout the Louisville area, with hopes that the doll would bring joy to the patients just like the toy did to Pearl. Cambrone, 59, tells People magazine, "Watching them hug the dolls and say, thank you, it just brings me so much joy." She continued, "I am just hoping that it makes a difference to comfort them in their last days. It makes me happy to see them to know that I can't make them well, but I could just try to comfort them." Cambrone says that her and her husband have given out at least 200 dolls over the years, and they've decided to call the project Pearl's Memory Babies. Now for In the Headlines. From Provider Magazine, White House 2019 budget seeks cuts to Medicaid, Medicare. It suggests that skilled nursing and assisted living providers take note that the Trump budget calls for deep cuts to Medicaid that could total more than $1 trillion over the next decade. Also, CMS says aging boomers are a big factor in health spending forecast. The Centers for Medicare and Medicaid Services, CMS, released its 10-year outlook for national health spending and enrollment and determined that a major driver for the faster rate of spending will be shifts in enrollment from private health insurance to Medicare caused by the aging baby boomers reaching Medicare eligibility. From McKnight's Long-Term Care News, the Pennsylvania Department of State has fined a nursing home operator $15,000 alleging that it misappropriated funds designated for a new Alzheimer's disease unit. Presbyterian Senior Living must also pay back $49,000 to one donor, according to the complaint. And lastly, a Georgia prosecutor announced late last week that 3 nursing home employees accused of ignoring the pleas of a World War II veteran in respiratory distress has been charged in his 2014 death. A former licensed nurse is now charged with murder and neglect of an elder person. Another former licensed nurse is charged with depriving an elder person of essential services, and a certified nursing assistant was charged with neglect to an elder person. All of them face charges of concealing a death. In NAHCA news, the National Association of Healthcare Assistants unveiled their new website last week and can be viewed at the new URL, NAHCACNA.org. The registration deadline for CNA Fest 2018 in Little Rock, Arkansas on August 21st and 22nd has been announced, and that is April 30th. And the Key to Quality Awards nominations are now available and will run until June 25th. For any additional information, you can go to NAHCA's website at NAHCACNA.org. This has been your long-term care news update. Everyone have a wonderful day, and I'll see you next week.